Christopher, how's it going today?
It's been great so far.
Good. Oh, I'm so glad to see you, and in person as well.
I know, it's after been 3 years since we
I
met
know,
virtually.
I know. It's so crazy how time flies, as they say. Having fun, of course. Now, we're going to be talking about what I think is probably one of the hottest topics at the moment, which is really around that value piece, data to dollars, making sure that it packs a punch, right? You've been with your organization 7 years now?
It's actually just crossed to 8 years.
Yeah, wow, there you
really
go.
Fun.
Yeah, just into 8. Across those 8 years, how many times have you been asked, how valuable is data? What are you doing over there? How often does that come into question?
I think in the early years, I wouldn't say it was happening a lot. There's not a lot of visibility into what was happening when they arrived. They had a couple of high-profile projects that were very significant investments, and the focus was bringing them to the level of being put into production. But I would say over the last 2.5 years, I think coming out of the throes of the pandemic in New York, the organization saw really a couple of different things that made them realize data was a really critical part of how we navigated it. You may remember this from when we last spoke. I think it was right in the middle of all of that. We saw more COVID cases than any health system in the U.S., and to say that it was all-consuming for the entire workforce would be the understatement of the century. But a lot of the work that my team had done previously in terms of how we were prepping data, how we were organizing it, particularly in the inpatient setting, making sure we had an index of currently admitted patients, and which gave us a finite number. At the time, we thought the number was like 3,500 patients that could possibly be in beds. That number spiked by over 1,500, which basically meant that people were in conference rooms that had been turned into ICUs, things like that.
Yeah.
But that's around the time that I was asked by the CIO and the COO to come talk to them about some investments they wanted to make. But getting through the initial conversations, they said, okay, first, I think it's the right call. We want to make the investments. But now I want to talk about how are we going to make decisions around what these resources are focused on. Because the function in and of itself, it's very costly. The technologists and SMEs and experts that have to do the work, they make pretty good money. And so how do we know? And so there's an exercise we undertook to really do two things. One was to organize some governance structure that was going to be owned by the most senior executives to help determine where we were going to focus our time and energy. But before we got into the numbers, really solidifying what the investment was, I said, okay, let's talk about baseline. Let's see what we got for what we paid last year. And it was definitely a different exercise at that moment, because essentially the function was more of an operating function, and that was kind of the model. And I was getting my work queue from a number of executives that were letting us know, okay, this is what you need to work on. So at that point we had to pivot. So I had to go through and really analyze the different types of work that we were doing, quantify it, and then start to reach out to some of the business leaders to have them help me to understand what is the impact that it's having. How are we measuring it? Is there a measurable outcome that we can bring back to the leadership team to let them know that, okay, this was actually money well spent? Or, okay, some of it was really good, but we need to do better, right? So the budget conversation started from, okay, let's talk about baseline. Let's see if we should continue to invest at the level we have even, which is a little alarming to hear when you realize that most of your cost is staffing.
Yeah.
But that was a pivotal moment for us. And, since then we've been really focused on what is the outcome potential that we're looking for, and partnering with our business constituents to define what success looks like and help us to agree on what the metrics are. And so some things like just compliance things, regulatory stuff, of course you do those because you don't have a choice.
Yeah.
Clinical outcomes is hugely important, so that's an acceptable thing to measure for sure. But the bigger successes we're having is when we can identify a target for cost reduction or for revenue generation. And the things that we've done over the last several years have generated really significantly impactful both revenue and reductions. So now there's a model where when we accomplish some of those things, the business partners invest in staffing that they assign to work with my team so that we can sustain that over the long haul. But it's really changing the model so that we're not focused on satisfying curiosities, we're looking to make noticeable, measurable improvements.
Yeah, and I suppose that's the maturity of the data function, is that you don't want it to be the case that people are coming to get you to work on small scale projects because as you say, they've got a curiosity about something.
Yes.
It's a case of building it into a wider product that can scale and be useful to the business. Now, you mentioned this moment in time where you really kind of took stock of what's valuable, what's working. We're on the 8 years, where are we talking about that happening?
I think that's probably been coming out of the pandemic. There's been a lot of stuff that we realized we needed to do some things to clean up the environments that we support. We're doing a lot of assessment of utilization of the platforms and the tools that we have out there. Just as simple as being a good steward of the power that it takes to run the data centers. If something's not being leveraged, we have a cycle. After 30 days, it gets flagged. 60 days,
right?
It gets kicked over to a developer by their manager. To reach out to the business. Let's find out if this isn't meeting their need or if they just don't need it anymore.
Yeah.
And if it hits the 90-day point, we send out a notification that we're going to deactivate it. If for any reason they need it, just to let us know. So we're taking something out that's no longer burning CPU power, burning electricity, and just kind of keeps the environment clean. I think we've dropped the overall number of solutions in our environment by over 50% in the last year.
Yeah, and it's such an important part as well, because if there can be this disconnect between the business and the data function, you can be producing these reports and insights, and if they never get used, it's just a waste of resource. And again, it loops perfectly back into the discussion we're having here today around value. Is you don't want to be working on things that collect dust. Right? Because that's not good use of time. It's not good use of effort at all. Now, it's really interesting that you took this stock take out of the pandemic. I feel so many people are in that process right now where they are taking a moment to just go, okay, that was kind of crazy. Where are we now? Because we are in a different world. I'm not going to say new normal. I've said new normal. We're in this place, and I feel like for a lot of people, they do have to assess what is valuable now, because what was valuable a couple of years ago is not the same thing. Do you think, alongside the pandemic and everything you went through, you clearly went through a large amount of digital transformation in that time as well? Where do you see that playing into this discussion around value?
I think there's two different things that come to mind. I mean, certainly, one of them was it really stressed that we needed to really get really disciplined about this and really try to figure it out. But it also really put things front and center. The data and digital are mutually dependent on each other, and if there's a brand new org structure that was stood up, I think in the early part of the year. Enterprise Digital Services. It's now it makes up what was all previously part of the IT organization, but also parts of other units within the organization. So I now work for a senior vice president, and I'm part of a leadership team for enterprise data and informational intelligence. It's a new vertical. It's really being established as a not only a partner but a trusted advisor to the executive team. There's a team that's really focused on the more traditional IT support, whether it's app support or development. There is a fantastic leader that just joined us from another health system that's focused on digital innovation, really from a partnership development standpoint, to where, in healthcare we're typically nonprofit. A lot of the things that we're doing with the intellectual capacities and the training, the disciplines that exist in a health system, that brings a lot of value to the table for technology partners who don't necessarily have that expertise. And so we're looking at developing relationships along those lines that are mutually beneficial. And clinical digital innovation is another area that's been carved out. You have a fantastic former CMIO who's now been elevated into a senior VP level, who's really focusing on that as well. It's extraordinary. I mean, they've really made some significant investments. There's been a couple of pretty big contract announcements with some big tech things that we're doing. I'm told there's probably more coming, but they're really heavily focused on removing the friction for the patient that needs to interact with the health system and the provider, and removing the friction for the provider. All the technology advancements that we've made, not all of them have been advantageous to the clinician. We're adding a lot to their workload. So we're really heavily focused on ways that we can give them FaceTime with the patient and do things like using automated or AI technologies to do essentially what we used to do with the dictaphones years ago.
Yeah.
So the documentation starts to get into the EHR during the patient's visit while they're in the room. So that their role then is just reviewing it, make sure it's good, it's clean, and ultimately they're hopefully home for dinner. That's the goal.
Yeah, for sure. Now, I made the kind of flippant remark earlier about data into dollars. Mm-hmm. I often get asked this question, and I'd be interested for your take. Do you think it is possible to put a dollar sign on everything you do in a data function?
Certainly, if you want to look at cost, I guess you can. But value is a little bit harder. There's things that we have to do because it's a cost of doing business, like the regulatory things. The government says you need to do this, then whatever it costs is what it costs, and we do that. But at the same time, there's also the aspect where you're dealing with healthcare. It's all about outcomes. It's about that experience for the patient. And all the good data analytics, all the technology, the thing that you're going to walk away from when you've had a positive experience, it's the human interaction you just had. It's not no one's coming to Northwell for our reports and our great analytics or anything like that. They don't even care about the technology. Yeah. But how did you feel, and how was that interaction? And so really, that's the critical piece of it. Probably more important than any of it. But then, of course, you want to be able to generate cost savings and revenue. There's definitely things that my team is engaged in that has indirect revenue streams coming into different parts of the health system. It's just by design. So I still look like a cost center, but I definitely can pull together some results and put them side by side. And I'm happy to say that we've had such measurable impact in the very first year we did this, two years ago. The revenue we were able to generate that was backed up by our supply chain leadership generated 3 times what it costs for my department for a year.
Yeah, amazing. And it's really interesting actually use the language around a cost center versus say a profit center and building that revenue for sure. I know there's so many organizations that are trying to move away from that cost center approach, and I think, as you say, there are some things you have to spend money on and you have to do, especially if you are in a regulated industry, you just have to do that.
Right.
Is there, in those activities that you have to do, is there a way that you can kind of flip the narrative into that being an opportunity as well, saying, well, we've got to do this, so we might as well make sure that we're doing it in a way that benefits the business as well as pleases the regulators?
That's absolutely the way that we've designed the executive oversight for this new function in enterprise digital. There's a governance team there that's taking a look at these. We're not talking about the things where if you're doing revenue cycle analytics, you're going to always need to do those things. You need to do operational reporting and that kind of stuff. We're talking about things that have significant potential for really big transformation. And that's always the challenge is figuring out which things have the most measurable impact are going to address the most critical pressing needs. And if it really impacts the patient or provider experience, we have to prioritize those things. Yeah. And sometimes there's just an upfront investment you have to make, and you do it because it's the right thing, but you always do it with an eye towards trying to produce a better outcome. I think equally as important as revenue generation is cost. I think our executive team is definitely doing a lot in the innovation space, creative joint ventures, things like that. So obviously they want to diversify the revenue streams so that we continue to reinvest. But then there's really a heavy focus on cost reduction, because we know whenever we hear the government talk about Accountable Care Act here in the U.S. or healthcare reform, it's code for they're going to probably give us less money. That's the objective. And so it's up to us to really figure out how do we make ourselves more efficient. Yeah. And it's a constant focus. We're being asked to help with that from a data and analytics standpoint, but everybody gets an assignment at the executive level, usually if getting around budget time, this targets, they want to close some gaps. Yeah. And that's our role, is to try to plug in and see how we can support them to do the analytics.
I think from a value-based discussion as well, it's really interesting that you constantly throughout this conversation put the patient as your North Star, delivering them value, and worked back from that as to how you can do that. And as you say, you've got these other needs and business demands that you've got to meet, but actually the end goal is that patient in mind. And I think that other organizations tuning in today who perhaps have customers or clients or stakeholders, it's the same approach that they need to take when it comes to value, and that data to dollar kind of approach. How are you giving them value and then coming back from that and working forwards?
Yeah, and I think that's the secret sauce. Is even in healthcare, it's really about the consumer experience. Whether you're a patient or you're a customer of a tech company, you have expectations, and if we're not paying attention to those, we're probably not going to have a lot of success. So we really need to make sure that we're listening, and it's for people in doing data and analytics. It's probably going to be a challenge for you to really figure out how to navigate this and how to make sure that you're getting the measurable results. But it's really, to me, comes down to partnership and relationships. Data and technology, it's cool for people like us, for sure. But the most impactful things that we have going for us really is how well do we establish relationships so that we have trust to work with the leaders and make sure that they understand we're here as a service, use us or not. We're here for you, and more importantly, when we have the ability to impact that interface between the consumer and any communication with our health system, no matter if it's the experience getting out of the car and being greeted by the security guard who might walk you to the door, whatever it is, we have to make sure that we're doing the work to enable those experiences to be very, very easy, very, very smooth. If we can do those things, in our line of work, it's a pretty cool contribution to be able to make, especially when it's recognized and you can see the results. We measure patient satisfaction all the time, so we can see when those numbers come out. We can also see our employee engagement survey results, whether they're physicians or even my own staff. So seeing the results come from the work that we do is extraordinarily rewarding. I think if we focus on those things, and I was just talking with a gentleman earlier, I think when folks go into a role like a CDAO, probably the most important thing to remember is there's no Superman. You got to put your cape on, put away. You need an army of people, and your success is going to be completely hooked to how many people can you enable to be successful in the space that they're responsible for.
Yeah, amazing. Well, great position to end on here today, Christopher. Thank you so much for joining me, and I'll let you get back into the networking session happening behind us.
Thanks so much, Catherine. It's been an absolute pleasure to chat with you.